Welcome to Integrity Linguistics Institute. Second question. The purpose of the guidelines for general practitioners is A option, to remind them to write asthma action plans. B, to raise their awareness of the value of asthma action plans. C option, to direct their discussions with patients about asthma action plans. So the second question, and it has been translated for you over here. And this has been done for North Indian candidates. Now, let's do the keyword analysis of the second question. The purpose of the guidelines for general practitioners is, answer option A, to remind them to write asthma action plans. Okay, so now let's do the combination strategy where we combine the answer option to the question to understand the better message. The guidelines for general practitioners serve to prompt them to create asthma action plans. B option, to raise their awareness of the value of asthma action plans. Okay, so what does that mean? The purpose of the guidelines for general practitioners is to make them more aware of the importance of asthma action plans. C option, to direct their discussions with patients about asthma action plans. So what does that mean? The guidelines for general practitioners aim to guide their conversations with patients regarding asthma action plans. Now let's read the text. Policy guidelines for general practitioners, asthma action plans. An integral part of asthma management is the development of a written asthma action plan by the person with asthma and or their carer together with their doctor. An asthma action plan helps the person with asthma and or their carer recognize worsening asthma and gives clear instructions on what to do in response. The process of developing a written asthma action plan is important, as this should be a discussion of the person's individual asthma and its management. The written plan is a reminder of that discussion. Written asthma action plans are one of the most effective asthma interventions available and have been shown to reduce hospital admission and emergency visits to general practice. Now let's read the text in simple English so that we can convey the message to you more clearly. Guidelines for doctors on asthma action plans. When someone has asthma, it is important for them, their caregiver, and their doctor to create a written plan. This plan helps them understand when their asthma is getting worse and what to do about it. Making this plan is crucial because it is a discussion about the person's unique asthma and how to manage it. The written plan serves as a reminder of that conversation. These written plans are very helpful and have been proven to reduce hospital visits and trips to the doctor for asthma problems. Okay, so now you have gone through the simplified version of the OET paragraph. Now you may go through the translated versions if at all if it is required. Now, what is the answer to the second question? The purpose of the guidelines for general practitioners is, the correct answer option is B, to raise their awareness of the value of asthma action plans. Now, let's understand why answer option B is the correct answer option. The answer, to raise their awareness of the value of asthma action plans, is justified by the paragraph's content. The paragraph discusses the importance of developing a written asthma action plan in collaboration between the person with asthma and or their carer and their doctor. It emphasizes that the purpose of this plan is to help individuals recognize worsening asthma and provides clear instructions on how to respond. The paragraph also highlights that written asthma action plans are one of the most effective interventions in asthma management, with a demonstrated ability to reduce hospital admissions, and emergency visits to general practice. Therefore, the guidelines for general practitioners aim to make them aware of the significant value and effectiveness of asthma action plans in managing, improving asthma care. Okay, so that is the explanation as to why answer option B is the right answer option. So now you may go through the translated versions over here. And now it is time to understand why each of the other answer options are eliminated. So A option is eliminated. So what is option A? To remind them to write asthma action plans. So why is this wrong? This excuse me. This answer is incorrect because the text does not suggest that the primary purpose of the guidelines for general practitioners is to remind them to write asthma action plans. While the text emphasizes the importance of written asthma action plans, the guidelines are more focused on the value and significance of these plans, their role in asthma management, and the benefits they offer to patients. The guidelines aim to do more than just remind practitioners to write the plans. They aim to raise awareness and provide guidance on their development and use. Okay, so that is the reason why answer option A is the incorrect answer option. So having eliminated answer option A, let's understand why C option is also eliminated. C, to direct their discussions with patients about asthma action plans. This answer is incorrect because the text does mention the importance of discussions between patients and doctors when developing written asthma action plans. But the guidelines themselves are not primarily meant to direct these discussions. Instead, the guidelines are aimed at raising awareness among general practitioners about the value and effectiveness of asthma action plans. While they encourage discussions, the guidelines serve a broader purpose of highlighting the significance of these plans in asthma management. Okay, so very clearly we have explained everything to you. So you may go through them by pausing the video to understand that more clearly. So understanding is crucial.